In how period, down there include been on 570,000 such a operative, and the difficulty bet is told to be 12 to 30%. Several patients include been leftward incapable to go or job, other leftward suicide. The medication and health means regulating agent continues to behind the use of herniation cell. 1 in 10 human beings will evolve a herniation. The largest overall treat involves a physician enterprising any convex fabric behind in the flesh and cover it in a chunk of surgery cell. Down there include been among 90,000 and 100,000 herniation cell operative in England every year with 2011 to 12. And guideline surgeons trust the difficulty bet is 12 to 30%, that tool among 68,000 and 170,000 patients could include been negatively struck in the history 6 year. Cell has been utilized for herniation repairs with the 1990s, so the full quantity who include skilled complications with its introduce is mind to be lot high. But NHS trusts in England include no consecutive politics for guidance on treat or pursue up in patients. Following Jen Coles, 34, had a cell implant in January 2017, next her herniation, the transactions leftward her in persistent ache. I was bent above and walk as although I was old and I couldn't stay up direct and it wound all the period, she told. I had a read since I fairthick felt very unstable on my feet. She has had a maintenance transactions to shoot too big trimming of cell. Her household pay for the transactions since they afraid it would get year on the NHS. Her common portability has superior, and the ache diminished, but she yet struggles to do specific tasks. Occasionally, I fair wish to shout. He's maddening, she told. Up the cell implant I was so busy, fleeing about commuting, kayaking, and now I can't choose up a toe of the story. Labour MP Owen Blacksmith, who chairs the all-side Parliament team on surgery cell implants, told he afraid the UK could potential include else fracas on our hands. He told the Medication and Health Means Regulating Agent, MHRA, whose job it is to provide care devices are secure, was not making quite to hear to the experiences of patients struck. It reflects the corrupted framework we include in location, he told. No one the regulators or the manufacturers include to pursue up on problems. Companies eventually include to get several liability for the. He's not nice for them to offer the to the NHS and later they go off in the NHS transport any obligation. This judgment to use cell should be done among patient and clinical recognition, the benefits and risks, it added. The King's School of Surgeons told cell implants were the largest efficient path to transactions in a herniation. Dr. Elrike Mashawek, a guideline herniation general surgeon in the individual segment, told she utilized a seam method, instead of cell, for largest herniation operative, but the technique was moribund out since youthful surgeons were seldom learned it. She told she had executed 3,000 cell absorption since of persistent ache, following that just 2 of the patients had not lost on to be ache-free. Dr. Susie L. Neal, a advisor urogynecologist who was a guideline vote in the Success campaigning to stop the use of vulval cell on the NHS in England, alleged treat such who had skilled complications in herniation cell could price a minimal of £25,000 a patient. The includes, it is such to the forecasted price for such purified for vulval cell complications.